So today we've been dispatched with a 24-year-old female who's complaining of lower lumbar back pain. She normally gets back pain, but she's been moving house over the past week and it seems to have exacerbated it. She has been up and moving today, but she's laid down on the couch. She's finding it quite difficult to get up and complaining of 5 out of 10 pain. So we've done a full set of vitals. We've found that all her vitals are within normal limits. She has no temperature. Her blood pressure is 120/80. She's got a rest rate of 16, a heart rate of 68 and a GCS of 15. Her blood glucose is 5.8. We're going to do a full assessment of her back pain and make sure she's got no red flags. Alright, do you have any stomach pain at the moment? No. Is it alright if I have a quick feel? Is that okay? No pain when I press down anywhere? No. Okay. So no abdominal pain or tenderness on palpation. Alright, and you haven't had any fevers or a feeling temperature of that? What about kind of general unwellness? Have you had the flu or a cough or a cold? No. No, okay. That's good. Alright, no nausea or vomiting or anything like that? No headache? Okay, wonderful. Alright, now where do you feel the pain the most?
It's like in my left, like
just right in the back there?
Yeah, and then kind of down my leg.
Okay, so it goes down this left leg. Does it go down your right leg at all? No. No, okay. Can you feel any numbness or tingling in either of your legs? No. What about in your hands? No. Okay, alrighty. Can I have a quick feel? Are you able to push down on my hand with this foot? Cool. Yeah. And back up this way? And are you able to straighten that other leg out? That's the one that doesn't hurt?
No, just a little bit.
And do the same on this one. Push and pull. Alrighty. And you've been up and walking today, haven't you?
Yeah, I've been able to, like, a little bit just hurts quite a bit.
Okay. Do you have any kind of altered sensation or pain on the inside of your thighs? No, right. Can I have a quick feel of your back? Is that okay? You just turn to face the other side of the couch.
A little more?
A little bit more. Perfect. Alrighty. So is there any pain if I press down your spine here?
No.
No. None of that hurts?
No.
Right down the middle? No, that's fine.
No, it's okay.
What about on the side here?
Yeah, it's
A little bit sore. What about on this other side?
No.
That's okay. So does it hurt if I push right in here?
Yeah.
Yeah? That's where most of the pain is? Okay. And can you feel it kind of shooting down your leg there?
Yeah.
Alright, okay. You can lie back on your side now. And you've got no pain in your chest at all?
No.
And not up in the middle of your back where I was pressing either?
No.
And then your neck's fine?
Yeah.
Okay. Alrighty. Wonderful. Okay. I'm just going to have a quick chat to my partner. It looks like hopefully we'll be able to leave you at home today and we'll come up with a bit of a plan. So after a full assessment of this patient, she seems safe to be left at home. So we've done a full assessment, found that she's got no red flags. She's got no loss of bladder or bowel control. She has no abdominal or thoracic pain, including no pain in her chest. She does have pain radiating down one leg, but it's not radiating down both, and there's no altered sensation in either leg. She has good motor power. There's no altered sensation in her saddle area, and she has no temperature or rigors or any signs of generalised illness. So provided that our patient can mobilise, we're going to be able to leave her at home and advise that she go see her GP within 12 hours as she has one orange flag present. We've sensitively ruled out that she's not an IV drug user, she's not pregnant, she's had no recent unplanned weight loss, and she's not immunocompromised with no relevant health history. So we're just going to have a check with our non-transport pause and checklist to make sure that she is safe at home. So she's been fully assessed, including a full set of vital signs. None of her vital signs are significantly abnormal. We've excluded any serious illness or injury. There's no red flag present in the lumbar back pain section. She's able to be left at home provided that we can see her mobilise before doing so. And we're going to explain to her about when she needs to seek further help, including leaving a lumbar back pain information sheet. And we're going to leave her with a copy of her documentation for her GP. Alright, so Jamie, after having a look, I think it's probably just a musculoskeletal pain. There's no kind of signs of an acute illness or injury. So what I want to do is I want to get you up and see if we can walk you around. And if you're able to get up and walk around, then I'm going to suggest to you that you go see a GP within 12 hours. Are you able to go see your GP today?
No.
Alright, okay. And you've not taken any pain relief or anything like that so far?
I took like a couple Panadol, but like probably 5 hours ago when I woke up.
Okay, so it was quite a while ago. Alright, so it's not within the last 4 hours? No. Alright, okay. So what I want to do is I'm going to give you a couple paracetamol, some ibuprofen, some tramadol. Have you taken tramadol before?
Yes.
You have, and you've been okay with it?
Yeah.
Okay, and you've got no allergies to any medications at all?
No.
No? You're alright? Okay. Alright, so we'll see if we can get you up and walking and then we'll give you some pain relief, okay? Alright, okay. So do you want to try and getting it?
Sure.
Okay. Alrighty. Perfect. then you're able to just get up and take a few steps around. Okay. How does that feel?
It's like more sore, but yeah.
Yeah. Okay. So then you're able to walk around quite.
Yeah.
Quite on that. Okay. Okay. Perfect. Do you want to just walk over just to the corner and back maybe? Cool. Okay. Do you want to take a seat? Right. So we've excluded that you have any allergies or anything like that. And so what I want to give you 3 paracetamol tablets, 3 ibuprofen tablets, and a tramadol tablet, okay? Now, it's a little bit more than you'd normally take. That's just because you're in acute pain. Later on, I want you to go see your GP. If after 4 to 6 hours you still have some pain, you can take some more paracetamol and ibuprofen as per packet instructions. Yeah. Okay, you're right. So I'll give you this glass of water here. And there's 3 paracetamol tablets, so that's 1.5 grams. 3 ibuprofen tablets, so 600 milligrams. And 1 tramadol, which is 50 milligrams. Alright, so you can just take those as you need to. Okay, alrighty. Perfect, okay. Alright, so we'll do some paperwork and we'll leave you with that, and there's a number you can take into your GPs that can get that as well. We're just going to leave you a information sheet about back pain, okay, so that there's some kind of signs if you see any other bad signs, if you fall unconscious or anything like that, we need to call an ambulance back and we need to go see your GP. Okay. Okay, you happy with that plan? Yeah. Wonderful. Okay. So today we've been called to a 23-year-old female. She's complaining of epistaxis. She's explained to us that she normally has epistaxis, however this one's gone on for longer than she's expected, so she's called through to an ambulance. We've asked her to compress her nose on the fleshy part of her nose using a complaint. We've estimated that she's lost about 250 mils of blood loss so far, just by having a look at the towels and things that she's been using. She's only losing blood out of one nostril, and we've got her sitting forward to keep her nose forward. Alrighty. She's got no medical history, she's got no drug allergies, she's systemically well and she's in no pain. She's had no trauma to her face, and we're going to leave that on to compress the bleeding for about 15 minutes to see if it stops. If it hasn't stopped within about 15 minutes, then we're going to look at administering some intranasal adrenaline. So we've had the patient compressing her nostrils for about 15 minutes now. The bleeding hasn't stopped. We've confirmed that she's not taking any anticoagulant medications and she's not on any medications at all. Her vitals have all been within normal limits. She's got a heart rate of 68, a blood pressure of 120/80, a rest rate of 16, GCs of 15, and her temperature's within normal limits. So what we're going to do now is we're going to administer some intranasal adrenaline to try and stop the bleeding. Okay, so this adrenaline that I'm talking about is medication that goes up in a mist into your nose, and hopefully that'll stop the bleeding for us, okay? And then we'll have a look, and if that stops, then after that we won't need to take you through to ED. If it doesn't stop the bleeding, then we will need to take you into hospital today, okay? Okay. Alrighty, wonderful. So we're going to draw up some intranasal adrenaline. To do that we need a 10 ml syringe, a 3 ml syringe, a drawing out needle, mucosal atomizing device, 10 ml of saline, and some adrenaline. So I'm just going to get my offsider to drug check this for me. Can you check that for me, please?
Adrenaline, 1 ml with 1 meg, and it expires in 2018.
Perfect, thank you. Alright, so first of all what we're going to do is create a solution of 1 in 10,000 adrenaline. So we're going to do this by drawing out 9 ml of saline. Alright. Okay, and then we're going to add in the 1 ml of adrenaline. So, we've had this drug checked. Cool. So that's our 1 in 1,000 solution. Alrighty. We're going to make sure we label that to say that there's been adrenaline added to it. Now to administer adrenaline IN we need 0.2 megs per nostril, which is 2 ml of this solution. So we're going to use our 3 ml syringe to draw off 2 mils. And we're going to add on omnipresent atomizing device. Alright, and this is ready to be administered to the patient. So Jamie, since the bleeding hasn't stopped over the last 15 minutes, we're going to administer this adrenaline, okay? We're then going to compress your bleeding again, compress your nose to try and stop it for another further 15 minutes, and we'll reassess after that, okay? So just before we do this, when I give this to you, as I say go, I want you to take a big sniff in, alright? Yeah. And then just replace the bandage back over your nose, just to press bleeding. Before we do that, can you blow your nose to blow out any of the clots and things that are in there? Alright, okay. You ready? Yep. You can just take the bandage away now. Alright. Okay. So on 3, take a big sniff. 1, 2, 3. Perfect. Alright. Okay, so we're just going to compress that for another 15 minutes and we'll see how we go. Okay. Alright, so Jamie, do you want to just take that away and we'll have a look? So do you think the bleeding stopped now?
I think so.
Alright, can we just have a look at that? Alright, cool. So it seems to have stopped now, which is good. Alright, so what I'm going to do is, I don't think we need to take you to hospital today, but I do want you to see your doctor within the next couple hours, okay? Yep. I also want you to avoid taking any hot showers, drinking any hot drinks, or blowing your nose for as long as you can. Okay. Alright, okay. Because I know it's quite tempting too, but it can start the bleeding up again. Okay, so what I'm going to do is I'm going to do some paperwork. I'm going to leave it with you and I'm going to leave it for you to take with you to your doctor, okay? And if the bleeding starts up again and becomes severe, feel free to call the ambulance back or pop in to see your doctor a lot earlier, okay? So within the next couple of hours. Alright, cool. I'm also just going to complete a little checklist to make sure that you can walk around and do things normally. We've done your full set of vital signs, so you look like you're quite well. Cool. Okay, alrighty.